Today we look at heart attacks through the story of a beloved actor, James Gandolfini. Gandolfini was born on September 18, 1961, in Westwood, New Jersey, to Italian-American parents. He grew up in Park Ridge, New Jersey, and graduated from Park Ridge High School in 1979. He then attended Rutgers University, where he earned a Bachelor of Arts degree in Communication Studies. The beloved actor known for his iconic role as Tony Soprano on the HBO series The Sopranos died unexpectedly on June 19, 2013, while on vacation in Rome, Italy. He was 51 years old. Gandolfini had spent the day sightseeing with his son, Michael, and had dinner with him at a local restaurant before returning to their hotel. While in his hotel room, Gandolfini began experiencing chest pain and difficulty breathing. Hotel staff were alerted and called for emergency medical services, but despite their efforts and those of the paramedics who arrived on the scene, Gandolfini was pronounced dead at a local hospital. An autopsy later revealed that Gandolfini had died of a heart attack caused by coronary artery disease, a condition in which the blood vessels supplying the heart become narrowed or blocked. Gandolfini's death came as a shock to fans and colleagues alike, who mourned the loss of a talented actor and kind-hearted individual. Tributes poured in from around the world, with many remembering Gandolfini as a gentle giant with a big heart, both on and off the screen. In the years since his passing, Gandolfini's legacy has continued to live on through his memorable performances and the lasting impact he had on the entertainment industry.
A heart attack, also known as a myocardial infarction, occurs when the blood flow to a part of the heart muscle is blocked, usually by a blood clot. When the heart muscle doesn't receive enough oxygen and nutrients, it can become damaged or die. During a heart attack, a person may experience chest pain or discomfort, which can spread to the arms, neck, jaw, shoulder, or back. Other symptoms can include shortness of breath, sweating, nausea or vomiting, lightheadedness or fainting, and anxiety. A heart attack is a medical emergency that requires immediate treatment. The longer the heart muscle is without blood flow, the greater the damage can be. Treatment for a heart attack typically involves restoring blood flow to the affected part of the heart as quickly as possible, often through medications or procedures such as angioplasty or stenting. It is important to recognize the symptoms of a heart attack and seek medical attention immediately if they occur, as prompt treatment can help to prevent further damage to the heart and improve the chances of survival. The most common cause of a heart attack is coronary artery disease. We call that CAD, which is a condition in which the blood vessels that supply the heart become narrow or blocked due to the buildup of plaque, a waxy substance made up of fat, cholesterol, and other substances. Other factors that can increase the risk of a heart attack include high blood pressure can damage the blood vessels and increase the risk of developing CAD. High levels of cholesterol in the blood can contribute to the buildup of plaque in the arteries. Smoking can damage the blood vessels and increase the risk of developing CAD. People with diabetes are at a higher risk of developing CAD. Having a family history of heart disease can increase the risk of developing CAD and having a heart attack. Being overweight or obese can increase the risk of developing CAD. Lack of physical activity can increase the risk of developing CAD. Age and gender. The risk of heart disease and heart attacks increases with age, and men are more likely than women to have a heart attack. It's important to note that not everyone with risk factors will have a heart attack, and some people without any known risk factors can still have a heart attack. Taking steps to reduce your risk factors and making lifestyle changes to improve your heart health can help reduce the risk of having a heart attack. The symptoms of a heart attack can vary from person to person, but the most common ones include chest pain or discomfort, which may feel like pressure, squeezing, fullness, or pain that lasts more than a few minutes or goes away and comes back. Pain or discomfort in the upper body, such as the arms, neck, jaw, shoulder, or back. Shortness of breath, which may be accompanied by chest discomfort. Nausea, vomiting, or lightheadedness. Breaking out in a cold sweat. Early management of a heart attack is crucial and can help reduce the damage to the heart muscle. If you or someone around you experiences the symptoms of a heart attack, it is important to call emergency services, such as 911 in the United States or 999 in the UK, immediately. While waiting for emergency medical services to arrive, you may be instructed to rest and try to stay calm. Chew and swallow an aspirin, unless you are allergic to aspirin, or have been told by a doctor not to take it. Loosen any tight clothing. If you have nitroglycerin tablets prescribed, take them as directed by a doctor. It is important not to drive yourself or someone else to the hospital if you think you are there having a heart attack, as this can delay treatment. Emergency medical services can provide early interventions, such as oxygen and medications, and can transport the patient to the hospital. Also, immediate management while awaiting emergency services may include: if possible, monitor the patient's vital signs, including breathing, pulse, and blood pressure, and provide any necessary support, such as oxygen therapy, if available. If the patient loses consciousness, begin cardiopulmonary resuscitation, CPR, immediately until emergency medical services arrive. If the patient has a history of heart disease, medication allergies, or other relevant medical information, share this information with emergency medical services personnel once they arrive. Early management of a heart attack out of the hospital can help reduce the damage to the heart muscle and improve the patient's prognosis. It is important to seek prompt medical attention if you experience any symptoms of a heart attack, even if you are not sure whether it is a heart attack or not.
Preventing heart attacks involves making lifestyle changes that can help reduce your risk of developing heart disease, which is a major cause of heart attacks. Here are some ways to prevent heart attacks. Quit smoking. Smoking is a significant risk factor for heart disease, and quitting smoking is the best thing you can do for your heart health. Maintain a healthy weight. Being overweight or obese increases your risk of developing heart disease. Eat a healthy, balanced diet and exercise regularly to maintain a healthy weight. Exercise regularly. Exercise helps to keep your heart healthy and strengthens your cardiovascular system. Aim for at least 150 minutes of moderate intensity exercise per week. Manage stress. Stress can contribute to heart disease, so it's important to find healthy ways to manage stress, such as exercise, meditation, or deep breathing. Control blood pressure. High blood pressure is a major risk factor for heart disease. Monitor your blood pressure regularly and work with your healthcare provider to keep it under control. Control cholesterol levels. High levels of cholesterol in the blood can contribute to the development of heart disease. Eat a heart-healthy diet and talk to your healthcare provider about medication if necessary. Control blood sugar levels. High blood sugar levels can increase your risk of developing heart disease, especially if you have diabetes. Work with your healthcare provider to manage your blood sugar levels. Limit alcohol consumption. Excessive alcohol consumption can increase your risk of developing heart disease. Limit your alcohol intake to no more than 1 drink per day for women and 2 drinks per day for men. By making these lifestyle changes, you can help prevent heart disease and reduce your risk of having a heart attack. If you have a family history of heart disease or other risk factors, talk to your healthcare provider about ways to reduce your risk and improve your heart health. Thanks for watching and see you next week. Please do like and subscribe.